Hi Nurse Family, Nurse Erica here. Today I'm going to show you how to insert a urinary catheter, indwelling urinary catheter on a male patient. If you're curious on how to do it on a female patient, that video is already posted for you online. So I have, for the sake of this video, already reviewed my order. I agree with the indication for the urinary catheter, and I have gone to my patient. I've explained the procedure to my patient. My patient is agreeing to the urinary catheter, although I don't need a written consent. My patient, should still know about what I'm doing and why I'm doing it, and they always have a right to say no. In this case, my patient is intubated today, so he's quite agreeable. I have already gone ahead and grabbed my peri wipes and wiped and cleaned the patient. Now, in my female indwelling urinary catheter video, I talked to you about how when we're cleaning with just our peri wipes, it's a great time to find the meatus. Now, on a male patient, that is the time when you would figure out if this patient is circumcised and if there's any, things that you would worry about when inserting the catheter. You should always think about, am I going to need assistance? Am I going to need someone else to help me with this patient if this patient is non-compliant? Because I do have to maintain sterility. And you should also find out if your patient has a history of an enlarged prostate. But sometimes they may or may not know that. So we'll talk about that in a minute. So if I do see that my patient is not circumcised, I'm going to pull the foreskin back and clean with the peri wipes and leave it back for the remainder of the procedure. Okay, so I'll talk a little bit more about that as we're inserting the catheter, but I just want to let you know what supplies you need. So I have an indwelling urinary catheter kit, and today I chose a 14 French, which is a pretty nice size. It's not too big. And I have an extra set of sterile gloves just in case I contaminate my hands. I would also have some type of securing device. A stat lock is very common now, or the leg strap to keep the urinary catheter in place. Okay, so let's go ahead. So I am going to go ahead and expose my patient because once I become sterile, I'm not going to be able to do that. So my patient is exposed, and I know that if I had an extra set of hands and I had someone here, then maybe I don't have to expose him as quickly. But since I'm by myself today, I'm going to expose him as I set up my sterile field. Depending on your facility, you may require another nurse to witness you perform the procedure to make sure you do not break sterility. All right, so what I'm going to do here is actually pull the sheets a little bit more because I really want to have a nice workspace and I don't want to contaminate. There's a perforated line there, so I'm just going to rip that open. And I like to keep this as my trash bag. Okay. My patient's bed is already up so that I don't have to bend down or I don't have to reposition the bed. Okay. I'm going to open the first flap away from me, making sure I don't reach over it. And I'm going to open my right side. And now the left. And then lastly, from the outside, I'm going to grab this flap. Now, anything that is hanging over my overbed table is considered non-sterile. So if I have any kind of equipment or supplies that falls on that area, that they are no longer sterile. So I have my sterile gloves. I can go ahead and put on my sterile gloves here. For the sake of the video, I'm going to do it on the bed. My patient is compliant and I have space, so I'm going to do that. Some people might not like that. Okay. If you know that the sterile gloves in the kit do not fit, that's also another good indication to bring some gloves with you, okay? Now I'm fixing the glove from the inside, not from the outside, because I don't want to contaminate it. Now I also leave this little wrapper here. I can remove it if I want to, but it could also serve as another trash can if I needed it to. All right, so the first thing I'm gonna grab is this blue drape, and the shiny side has to go down, and I wanna keep it sterile so I can put my kit on it later. So I'm going to wrap my hands, protect my hands, and just drop it. Now, This is a mannequin. His legs don't open too well, but you know what? On a contracted patient, their legs might not open too well either. So we work with what we got. Main thing is that area is covered. If I want to put my kid on it, I can. The next thing I want to do is open up my fenestrated drape. And you see this little hole here. Be careful not to play with it too much. Sometimes my students want it perfect and then they contaminate their hands. So I'm really happy with that. So now I'm going to gather my supplies. I'm still sterile. Both hands are sterile. So this is the time to gather everything and get it all ready while I have two hands. So I like to put my swab sticks right on top of my kit. Some people like to put it on their tray. Either way is fine. It's like the next thing I need to do is look at my syringes, and this one is the lubricant jelly, so I don't want to connect that to my balloon. I'm going to grab my sterile water syringe, and you definitely need two hands for this, so this is the time to do it. And I connected it to this green port here. Okay, and now I'm going to remove the tip of this sheath. Now, go by what your facility policy says regarding the sheath. If you have the sheath on your catheter, you can completely remove it. Some of the new Bard kits are coming without the sheath. I personally find it more comforting for myself to keep the sheath on. It makes me feel like I'm keeping the catheter protected. But again, some of the kits don't even have them anymore. So what I'm going to do is lubricate my catheter, and remember, everything here is sterile. And this is a male patient, so you're going to have to go further with the catheter, so it's really important that you lubricate the catheter well. The other thing that I'm going to do based on the reference that I'm using today is I'm also going to lubricate in the meatus, so you'll see that in a minute. So now that my syringe is connected, I have my cleaning wipes in my tray. I'm going to go ahead and bring everything over to my patient. Okay, so before I contaminate my hands, because right now I'm sterile and everything in my tray is sterile, I like to do one last look to make sure that I have everything ready. And yes, I have my swab sticks to clean, I have my lubricant jelly, and my syringe is connected to my balloon port. So now I'm going to take my non-dominant hand. I'm going to firmly grab the shaft of the penis, and I'm going to keep my non-dominant hand there for the remainder of the procedure. This hand, my dominant hand, is going to remain sterile. So I'm going to grab the first swab stick, and I'm going to start at the meatus, and in a circular motion, I'm going to go outward. Never outward in, because remember, the meatus is where the catheter is actually going to go into. And I'm going to do it 3 times. So starting at the meatus. Now, it's important to say that on a normal patient, on a real patient, the meatus will not be this big. This is a simulated patient. Okay, the meatus is typically about, if you clench your fist like this, it's kind of like, it's similar to that. That's in size. Okay, so now I've cleaned my site, and because the catheter has to go in a lot further than it would on a female, I'm going to also go ahead and inject some lubricant jelly inside of the meatus, because I want to make sure that this is not painful for my patient. And I also lubricated the tip of my catheter. So I'm going to go ahead and grab my catheter, and I'm again holding the penis firmly. So as I'm inserting the catheter, if I feel any resistance, I can ask the patient to cough and take a deep breath, and I can try to maybe move the penis in a way so that the catheter can go in. But if I continue to feel resistance, I'm never going to push past that resistance, because that might mean that my patient has an enlarged prostate. So I will stop the procedure, explain the procedure to the patient, and notify the provider. And in those cases, many times the urologist will come in and they'll use a catheter called a Coudet catheter, and it's angled at the tip, so that it allows it to kind of maneuver through the urethra a little bit better. Okay, so depending on the resource that you are using, the resource might tell you to go to the Y. So if you see, this is the Y, right? I have gone in pretty far. I've seen urine. I've gone in 2 to 3 inches above that, and I'm close to the Y. I think that I'm in the bladder. It's safe to say that I'm in the bladder. So I'm going to go ahead and inflate my balloon. Now, if I inflate the balloon and I feel resistance, and I'm not right now it's going in pretty smoothly, then that could mean that I'm in the urethra. So again, the catheter needs to be advanced further because you're in the urethra. So here now I've inflated, I've put 10 cc's in. I'm gonna go ahead and disconnect the syringe, very important, because otherwise your balloon will deflate. And now I'm gonna get rid of my sheath by just pulling on the perforated line. And I should actually tug on the catheter gently to see that it's in place. And yes, it is in place, if you can see. Okay, I'm gonna remove this, and I'm gonna take my trash. I'll put it in my little bag that I left. Okay, so I've removed my contaminated gloves. I performed hand hygiene, and now I have clean gloves. So I'm gonna remove this, and I'm going to take note of how much urine I have in my urinary drainage bag. That's going to be important for documentation purposes. I'm going to document that I have a 14 French urinary catheter, that my patient tolerated the procedure fine, and that I had 100 cc's of dark amber urine. Okay, the next thing that I would do, and I don't have a securing device today, but in your facility, you will have a securing device, and you're going to want to secure the catheter to the thigh. Being careful not to pull on the catheter too much. You want to have a little bit of leeway here. So I'm going to secure the device in a way that it's not too loose or too taut. Okay, so this is about right. And now I'm going to cover up my patient. I'm gonna put the bed down. I'm gonna perform hand hygiene, and I'm going to document and make sure I take all my trash. That's how you insert an indwelling urinary catheter on a male patient. I hope this was helpful. If you have any questions, feel free to go ahead and ask me in the comment box. I really have to stress that you should always use your nursing resource that your university recommends, okay, that your nursing school recommends, or if you're working in a hospital, you want to use the policy in your hospital.